Hi, my name is Evangelisa Grace, and this is my SSM assignment, which is about dermatology. So, first, what is dermatology? Dermatology is the medical discipline that is concerned with the diagnosis and treatment of diseases of the skin, hair, and nails in children and adults. A, a dermatologist is a doctor that specializes in treating the skin, hair, and nails. Speaking about dermatologists, Dr. Melinda Tong Mui Leng is a well-known dermatologist practicing here in Kota Kinabalu, Sabah. She also owns a clinic of her own located in Luyang. Dr. Melinda was involved in the first case report of the Rothman-Thompson syndrome in fraternal twins in Southeast Asia. She has also conducted studies on the efficacy of tea tree oil in treating tinea pedis, a fungal infection affecting the feet. Moving on, let's talk about the skin. The skin is the largest organ in our whole body, and it is also known as the cutaneous membrane. It weighs about 4.5 to 5 kilograms, making it about 7% of our total body weight. The skin has numerous functions. For example, the skin helps to regulate our body temperature, such as through vasodilation or vasoconstriction of the blood vessels. The skin also acts as a reservoir of our blood because most of our blood vessels are located in the skin. Moreover, the skin acts as a mechanical protection against injuries or any kind of physical abrasions. Next, the skin is also involved in our sensation so that we can feel the temperature of certain objects. And the skin is also involved in excretion and absorption, mainly like sweating during exercise. And lastly, the skin is involved in synthesizing vitamin D, which is crucial for our body. So this is the anatomy of the skin. So based from this picture, you can see the epidermis, which is the uppermost layer and also the thin one, and the dermis layer, which is the deeper and thicker layer. So let's start with the epidermis first. The epidermis. So in the epidermis, you can find four kinds of cells. The layers of epidermis are the stratum corneum, stratum lucidum, the stratum granulosum, the stratum spinosum, and also the stratum basal. The stratum corneum is moving on to the dermis layer. The dermis is composed of dense irregular connective tissues that contains collagen and elastic fibers. The dermis has two layers, which are the papillary layer and also the reticular layer. The papillary layer, as you can see, it consists of blood vessels, some nerve fibers, touch receptors, and also phagocytes. Whereas the reticular layer involves the sweat glands, the hair follicles, the fat cells, and includes the blood vessels as well. One of the biochemical processes that occurs in the skin is melanin production. The melanin is produced by melanocytes, which are located in the stratum basal layer. The melanin is what gives our skin color, and it functions to absorb UV light. There are two types of melanin, which are eumelanin, that gives the skin brown to black color, and pheomelanin, which gives the skin red to yellow color. The next biochemical process is the vitamin D synthesis. So, in the presence of sunlight, 7-dehydrocholesterol in the skin is converted into cholecalciferol, also known as vitamin D3. This vitamin can also be obtained through supplements and food source, such as fish. And in the liver, it will be converted into 25 hydroxy vitamin D3. Then in the kidney, it is further hydroxylated to become 125 dehydroxy vitamin D3. Now I will be talking about psoriasis, which is one of the dermatological skin conditions. Psoriasis is an autoimmune disease characterized by symmetrically distributed red and scaly plaques with well-defined edges, as you can see from the picture on the right side. So how does psoriasis occur? From what I've said before, psoriasis is an autoimmune disease, which means the body's own immune system attacks itself. So in this case, the T cells attack the healthy skin cells. The T cells then will release signals that make the skin inflame. And the body responds by producing new skin cells faster than it needs to. And this makes the extra skin cells pile on top of each other. And this is what forms the plaques. So psoriasis also often occurs alongside with other autoimmune disorders such as arthritis, thyroiditis, and alopecia. So there are many kinds of psoriasis, and there are about 9 of them, which are gouted psoriasis, the chronic plaque psoriasis, the unstable plaque psoriasis, the flexural psoriasis, the scalp psoriasis, seborrheic psoriasis, nail psoriasis, palmoplantar psoriasis, and erythrodermic psoriasis. There are various ways on how psoriasis can be treated depending on the severity of the psoriasis itself. Dermatologists will usually give topical treatments first, like emollients or topical corticosteroids or topical vitamin D and many more. And if that does not work for the patient, they will give phototherapy, such as UVB light, a laser treatment, or through PUVA. And if the patient is not responding to that as well, the dermatologist will consider giving oral medications to the patients. UVB phototherapy is a form of phototherapy that can help treat psoriasis. So for this kind of treatment, patients will enter a specifically designed cabinet in which short-wave ultraviolet radiation is delivered directly to the skin. How is it delivered? It's delivered through these light tubes which are positioned on the walls of the cabinet. And these light tubes will target the affected areas with ultraviolet radiation. So for psoriasis patients, they will be given this treatment usually 3 times per week with a maximum of 30 minutes per session. How does phototherapy helps with psoriasis? It helps by reducing the immune cell activity, specifically the helper T cells T1 and T7, which makes the skin inflamed and red. Next, it inhibits the FOXP3 plus cells, which are a group of T cells that activates the immune system. And lastly, it induces cell death, also known as apoptosis, in some types of immune and skin cells. And that's all from me. Thank you.